And so you see the Republican Senator Cruz self-quarantining, Congressman Gosar of Arizona, as you mentioned. Congresswoman Liz Cheney did not go to the Republican meeting over the weekend because of her own concerns about coronavirus. And so you see the Republicans now grappling with all of this. And they're also trying to think ahead. Do they need to push this president not only to address the health and management issues of coronavirus, but will there need to be a fiscal stimulus, an economic stimulus later this year to provide stability to the economy? And those are some of the conversations that are already happening. The problem for President Trump is that he has a new chief of staff in Mark Meadows who has some relationships with Democrats, but limited. The president's at a standoff right now with Speaker Pelosi. So Congress is not in a perfect position, based on my reporting, to come forward with some kind of major package.
And John Heilman, before the President of the United States starts talking about fiscal stimulus, we need him to talk about the coronavirus and what his administration is doing. And I think the president himself needs to assure Americans he understands how critical the timing is of his response, instead of tweeting out conspiracy theory tweets last night.
Yeah, I think the president needs to do a couple things, Joe. The first is start telling the truth, and the second is to start marshaling the most competent forces within his administration, to the extent that those exist, both to deal with the problem and to project, to gain or regain public trust in terms of how the government's handling this. I think the most distressing elements is that none of those things, which are pretty basic, I mean, these are things I just said are not particularly complex. Tell the truth, try to get the most competent people in your administration to work on this and show the public they're working on it. Neither one of those are things that anybody has any expectation are going to happen or happen anytime soon. And so I think we're going to find out, and when the reporting is all done, on what has happened over the last month and how the administration has handled this. I think it's going to be one of the great scandals of the administration. We're going to find the depth of it. I think we're nowhere near understanding how badly handled and how dishonestly handled this has been. But we are not yet at the worst point. And on the basis of the way the president has behaved in public over the course of the last 96 hours or so, I don't think there is anything close to an awakening happening with him to get himself in a place where the public desperately needs him to be. Not just, this is not a political thing anymore. This is a question, not that it was ever just a political thing, but it's not, this is a thing that where dire public health issues are at stake in, and I don't think the president has any apprehension of that.
Jonathan Lemire, you obviously report at the White House. What can you tell us? Has there been a change in thinking among the president, or if not the president, if the president is still clueless, if the president is still just recklessly looking at this as a political challenge and not the public health crisis that it is? Are there people, at least inside the White House, who will not repeat the same things they said? Kellyanne Conway mocking and attacking a CBS News reporter for saying what we all knew then and know now, that the virus is not contained. Or Larry Kudlow saying that the virus was contained when the Surgeon General has said the virus is not contained, and others, Fauci, the virus is not contained. Nobody believes the virus is contained, and yet they were still saying it on Friday. Do you expect a change of tone on Monday? Will Kellyanne Conway come out and apologize for attacking the CBS News reporter today and say, well, yeah, it's not contained and we're actually in the mitigation phase now?
I'm pretty confident there won't be an apology, Joe. I think there are two things here. Once, first of all, just backing up a step, I think this is an administration that was too slow to react months ago when this crisis first began. The president, didn't want to be told the bad news. The Secretary Azar of Health and Human Services, on a number of occasions, tried to suggest to him, like, sir, this is becoming an issue in China. We need to start formulating a plan here. And the president was slow to do so, in part because he didn't want to be seen as alienating China, who he's working with trade deals with Xi Jinping. He doesn't want to embarrass him and criticize his handling of the virus there. He also, of course, didn't want to, at the time, battling impeachment, didn't want to have another distraction. He felt like he was going to come out of impeachment okay, wanted to have some political momentum. And he is someone, as we know, know who time and time again tries to put forth a narrative that everything is okay. Speaking of impeachment, by the way, CPAC, where now we know there was at least one confirmed case and people are self-quarantined because of it. CPAC, just a week or so ago, where then Acting Chief of Staff Mick Mulvaney criticized the media and suggested that their coverage of the virus was a hoax, that we were overblowing it. And here we are, people are quarantining themselves from that specific event. In terms of the White House itself, we are seeing an effort to try to get their arms around this. They're ramping up their response, but the president has been an obstacle to that. He has not wanted to acknowledge the seriousness of this crisis. He knows it can be politically damaging. We've discussed at length the haphazard and frankly irresponsible performance from him at the CDC. This weekend at Mar-a-Lago, we're told he's still calling allies, suggesting this isn't going to be that big of a deal, that this is something that will pass, the administration is going to be able to handle it. And that's simply flying in the face of reality. And we know, as a final point, time and again, he is someone who tries to assert his own narrative, assert his own truth. And he has had a lot of his supporters tend to believe him rather than the media, suggesting that he is the one who is reliable as opposed to the so-called fake news. But this crisis is different. That's going to test that because they can see, Joe, with their own eyes, in their own neighborhood. They're going to be able to see their elderly neighbor get sick. They're going to have their local school district closed. They're going to go to the grocery store and realize they can't buy hand sanitizer because their store is sold out. This is going to be a different reality, and the president is going to have to confront that.
Yes, and Trump supporters were mocking, again, you said Mick Mulvaney, but also members of Congress were mocking, actually, the concern that was being conveyed by healthcare providers and the press and the media. I want you to read this warning. Everyone should continue to treat this outbreak seriously and be driven by facts and medical science. We need to continue to be proactive in mobilizing resources to combat this outbreak. And I encourage everyone to follow the recommendations of the CDC and the health professionals in protecting their own health and welfare, as well as the health and welfare of those around them. That written last night by Senator Ted Cruz. Things are changing by the day.
The messaging from Washington is definitely confusing. Let's bring in epidemiologist and virologist Joseph Fair. He's an MSNBC science contributor. The president says anyone who wants a test can have it. We now know that is not true, Dr. Fair. But people who are exhibiting symptoms, feeling symptoms, often are going to emergency rooms. So I'll ask you the same thing I asked our chief medical correspondent, Dr. Dave Campbell. Why are people not being sent to coronavirus testing centers or coronavirus treatment centers to try and contain this? Isn't the possibility of people walking into emergency rooms with symptoms of coronavirus, doesn't that mean they spread it to the community that could actually help people get better? Isn't this
That's what's happened.
Isn't
and
this
Rockaway,
just kind of basic at this point, that there should be treatment centers around the country?
Absolutely, and the reason they're not walking into those centers and the reason they're not getting tested as readily as we would like them to be is because those centers do not yet exist. They exist in a handful of places around the country, and even those places are completely overwhelmed at the moment without having reinforcements, testing coming from the CDC, et cetera, coming back to them and reinforcing both their supplies and stocks. So we heard the case yesterday of the Seattle woman that's been trying for weeks. She was in the elderly care home that has been the most affected, and it took her literally weeks to get tested. So by definition, using words like contained would mean that we would not be seeing new states and new cases popping up in different states. And so using words like contained is not helping it, because if you look at the data and we see these new cases popping up everywhere, that's completely contradictory to the term contained. And going into an emergency room, going back to your earlier question, that exposes everyone else in that emergency room there who most likely do have those underlying conditions, which we've repeatedly mentioned. Anyone with COPD, lung problems, heart disease, that's going to expose them. Even if you yourself are going to be fine, if you're in that 80th percentile, you're endangering everyone else by reporting to those emergency room and overwhelming the system.
Yeah, and so, Rev, we have an example of this past weekend where one person, one patient that was feeling the symptoms of the coronavirus went into an emergency room on Long Island and went in there and may have infected 40 healthcare workers, doctors and nurses, technicians, all inside that hospital. So immediately one person walks in, 40 healthcare providers have to self-quarantine. And the fact that we're this far into a healthcare crisis and our administration and our government in Washington still hasn't figured out a way to stop that from happening. And again, beyond just the 40 healthcare providers who were completely taken out of that emergency room and now we're self-quarantined for weeks and can't treat other patients. You have 60, 70, 80-year-olds who may have been exposed to that virus, who now, whose very lives may be at risk.
No, and the thing that is most alarming to me is that the White House is not even outlining how we expand the testing. One of the things I said at Nash Action Network's weekly Saturday rally this Saturday is, what about those that are in low-income areas in dwellings where you have people that live in housing developments, people that go to church, and we have no access to the testing? How do we get testing sites, doctor, for example, maybe at churches and maybe at community centers? Because we're in communities that don't have a lot of health facilities that, by the very nature of our needs for work and income, and the fact that we live in multiple dwelling housing, we are around people all the time and are the least accessible to health services. Less known testing. We don't know how many people we may be around in a church service or in a multi-dwelling, just going home, getting up into our apartments. No one is even talking about that.
Absolutely, and the lowest income levels are always disproportionately affected by any infectious disease, but it's particularly this one. We've heard repeatedly, how much is the test going to cost? I can say it would be unprecedented that we would even charge for a test for a pandemic disease that would be offered for free normally. Same with the vaccine. It would be unprecedented that we would charge for a vaccine for a pandemic disease, because if everyone can't afford it, then we're all at risk.
All right, here is some of the reporting about the administration's response to the virus so far. Multiple sources familiar with the discussions tell NBC News that Trump is simply not on the same wavelength as the rest of his team handling the outbreak. But they said there is not much they can do to change his public tone. Trump has been advised by some close to him to let public health officials, rather than the politicians, take a more forward-facing role. But a person close to the White House said Trump thinks it helps him politically to keep doing what he has been doing. Another White House source said that has left aides feeling discouraged as they try to prepare the public for what could be ahead. The Washington Post is reporting that two major problems arose as the Trump administration struggled to contain the rapidly spreading coronavirus. Cities were not ready to contain it, and testing for the virus did not work. According to the Post, two senior administration officials argued that even in hindsight, the administration might not have done much differently, in part because it was important for the CDC to figure out exactly why its tests weren't working.
Despite the fact we had a global test that they could have imported.
Another quality control issue, for instance, could have yielded more inconclusive results, further exacerbating the problem, these officials added. Some in the administration, including Trump himself, viewed the initial steps to contain the virus as the solution rather than merely as a starting point from which to use to buy themselves more time. When it came to engaging President Trump in prevention efforts to the outbreak, the Post reports that in late January, HHS Secretary Alex Azar was having trouble focusing Trump's full attention on his coronavirus briefing. Azar had arrived to brief the president on the latest virus news, but Trump instead interjected, badgering the health chief about the administration's messy decision to implement a limited ban on flavored e-cigarettes. Why did you push me to insert myself into a controversial political issue? Trump demanded. The New York Times reports that the Trump administration has struggled since the very beginning of the coronavirus outbreak to successfully communicate with the American public. As early as February 25th, the Times reports that as CDC officials were warning about its impact and as, quote, the stock market plummeted, cable news blared apocalyptic headlines. And by the time Trump landed at Joint Base Andrews early the next morning, his critics were accusing him of sowing confusion on an issue of life and death. The president immediately got on the phone with Alex Azar, his Secretary of Health and Human Services. That call scared people. He shouted, referring to CDC warnings. Are we at the point that we will have to start closing schools? The president added, alarmed, according to an official who heard about the call. So, The Atlantic reported its exclusive findings on what it calls the strongest evidence yet that America is botching coronavirus testing. The piece says the capacity to test for the virus varies dramatically and sometimes dangerously from state to state. Quote, the figures we gathered suggest that the American response to the coronavirus and the disease it causes, COVID-19, has been shockingly sluggish, especially compared with that of other developed countries. Earlier this week, the CDC announced that it would stop publishing negative results for the coronavirus, an extraordinary step that essentially keeps Americans from knowing how many people have been tested overall. The haphazard debut of the tests and the ensuing absence of widespread data about the epidemic has hamstrung doctors, politicians, and public health officials as they try to act prudently during the most important week for the epidemic in the United States so far.
So, John Heilman, the Secretary of HHS went to warn the president about the...
Boy, oh boy, that right there. That's just a mouthful of itself, isn't it? I mean, that right there is just mind-blowing. That's a lot of stuff where a lot of people have stepped up to the plate. To do the right thing and had others to say, no, it's not.
Coronavirus, and the President of the United States instead began raging about flavored e-cigarettes. That story neatly encapsulates how clueless he's been since this outbreak began.
Yeah, I'm afraid that's certainly right, and I think Joe, I keep coming back to something you've been talking about, like it's kind of a recurring theme of the coverage of this over the course of the last few weeks as it started to unfold. Right, has been, that Trump has basically learned one lesson over the course of his time in office, which is that, by and large, he has paid very little political price for lying. By and large, he has paid very little political price, except in the grandest sense. We always point to the fact that, of course, there was the giant repudiation in the midterm elections. But in terms of his personal politics, the president has felt as though he could lie with impunity, and that there was nothing that he couldn't. If all he was ever trying to do was appeal to his base, there was no political threat that he couldn't just sort of deem to be a conspiracy, deem to be fake news, and that would work for him in the limited sense that he wanted to keep the people who were with him. This is a thing, though, this particular crisis is a crisis where the kinds of empirical kind of grounding of it and the fact that facts here are things that can't be spun away, they can't be denied, they can't be lied away. They are overwhelming, and they're tangible, and they're at the point now where they're about to overwhelm his capacity to just bluster his way through. And the e-cigarette thing is a classic kind of Trump. Part of the reason why the story is so typical of this situation is that it's a classic Trump thing. This is a story that he feels like he can get his head around, and so he kind of pivots to the familiar. This this virus and its political, economic, financial, scientific, public health implications is just overwhelming to him. And so that he is in denial about it is not surprising, because what's happening to him right now is a total system failure. Everything that he normally uses as a strategy in a tough spot is not working and is not going to work. And I think we are at the point where not only is this about to metastasize as a crisis, but where Trump is going to go, I think for the first time we'll ever really see him in a state of full-blown panic. That's where we're headed. That's a terrible prospect given where we are in the arc of this disease.
Bob Costa, we've been talking all morning about the need for the president to not be in denial, to stop blustering. But literally 1 minute ago, he's continuing. I'll read you his new tweet. The fake news media and their partner, the Democratic Party, is doing everything within its semi-considerable power, it used to be greater, in parentheses, to inflame the coronavirus situation far beyond what the facts would warrant. Surgeon General, he's quoting the Surgeon General saying, the risk is low to the average American. The president is still, Bob, unwilling to come to grips with the severity of this crisis, it would appear, and certainly that means policies aren't changing either. From your reporting, your sense of it, are there any Republicans, whether it's on Capitol Hill or perhaps his new chief of staff, Mark Meadows, who's more of a political warrior, perhaps, who are going to be able to get in his ear and say to him, sir, your approach needs to change here before this crisis completely envelops your administration?
I know our time here is brief, so let me open my notebook and offer you a few quick thoughts. The real situation over the weekend is this. There's no consensus on Capitol Hill because of the frayed relations to get anything done on that level beyond just more funding. They got an $8 billion deal, not much more at this point. So the real conversation is about federal power. What is the president and the executive branch going to do? Is he going to consider emergency measures to protect hospitals, to try to increase the number of ICU beds in this country, to really move forward in dramatic ways that could rattle an already rattled global stock market situation? And that's what's confronting the White House this morning.
We seen with our own eyes. It wasn't a delusion. It wasn't some sort of a dream. It wasn't mythical. It wasn't an ideal. We seen in our own eyes how Japan basically built 2 hospitals in less of a period of 2 weeks, a week per hospital, that ordinarily takes months, if not years, to produce. That in and of itself should have spoke volumes to the rest of the world of the severity and how urgent that this measure truly is. Whenever you see a country come together like China did in manufacturing a hospital, a coronavirus centers, in that length of time, that should have immediately spoke volumes to Donald Trump. I'm now beginning to realize or understand more about biblical Bible prophecy in how that it talks about in Revelation chapter 6 verses 1 and 2 that it was as the noise of thunder. One of the beasts said, "Come and see." Because there was various events that was happening upon to the planet that got the beast's attention to the point that he immediately screamed out to the heavens and said, "Come and see this." I'm now beginning to understand the gravity of what it meant of it was as the noise of thunder, indicating a very, very loud, enormous commotion up onto the planet called Earth. When one of the beasts spoke out into the heavens and said, "Come and see." I'm now fully understanding the depths of what biblical Bible prophecy was indicating. Because I have never in all of my life heard so much confusion and so much chaos and so much rigorous communications of one person having this opinion, while another person had that opinion, while this person had that opinion. And it's not just happening here in America, it's happening all over the world, all over the planet. Because this demon that has been released is actually unveiling itself in ways like none other has seen before. And until we understand the gravity of this virus, we're going to be bewildered of the severity of it. And it is severe. It is urgent. It is imperative. But I'm afraid it may be a day late and a dollar short in regards to actually preparing for something this enormous. A day late, a dollar short.
They all go to work. What measures will the executive branch take that could lead to economic pain? And that could include calling for schools to be closed. Things that could really have economic consequences for the next 2 to 3 to 4, 6 months. And that's the challenge this White House faces and Meadows is facing, because he's trying to surround himself with political allies right now who can make the message publicly. And he wants to go to war publicly on the message as Democrats continue their own campaign. But it's going to be an executive branch decision as Congress is at a standstill.
Well, you know, the problem with that is, of course, this president, as we've said from day one, is a day trader. He never makes the tough choice. He never makes the tough decision that will pay dividends down the road. We've seen China do it. We're seeing Italy doing it right now. But, Doctor, if the president does not make those difficult choices, Dr. Fair, the president does not make those difficult choices, obviously the consequences are great. If you had the ear of the president and policymakers on Capitol Hill, what would you be telling them they must do right now?
To be frank, I think it's appropriate right now to declare a national emergency or a national security emergency. We know that almost every state in the union is affected right now, and once testing is up and running, I have little doubt that all states in the union and our territories will be affected, I should say. That being said, we know our troops are at risk. We've had several troops, both Army and Navy, get infected. We know that ships are breeding grounds for the virus, et cetera. So this is both a national security matter as well as a federal disaster. I think it's time to declare that federal disaster because we have to get the testing out. We have to provide for individuals that they don't have the luxury of taking 14 days off of work, because if they're in the low income bracket, that's rent, that's food. How are they going to do that? Without a plan to get money and food and the needed supplies to those individuals, as well as save the businesses that they work for, we're going to see a much worse disaster than we have on our hands right now. And if I can compare this to other natural disasters, the most akin would be a forest fire. If you respond early and aggressively, you can contain the forest fire. If you let it go, it's going to continue to grow and grow and grow, and that's what we're seeing right now.
All right, Doctor, thank you so much for being with us. We greatly appreciate it. Obviously, sobering words, and the doctor just underlines the fact we need leadership. Bob Costa, thank you so much as well. We greatly appreciate it. Richard Haas, we heard about Well, actually, we'll get to him next.
Now, I would just like to add to
Yeah.
what Dr. Fair said, because unless there is a place for these people to go, coronavirus care centers, this is going to run rampant across the country. Like, we have to stop it and contain it by having a place for people to go when they have symptoms or they have the coronavirus. If they continue to go to hospitals and to their doctor's office or walk around with the symptoms, it's going to spread. We have totally failed. America has failed at dealing with this. The fact that these aren't put up in localities, even tents,
Right.
at this point for people to go to get tests. Oh, there are no tests. I'm sorry. They're walking into hospitals. This is crazy. You can't, canceling school is not going to help if people are walking into ERs with the coronavirus. We're going to see it happen. It's going to play out, and you can thank Donald Trump for this.
Well, and again, the crisis comes just right now because we're walking darkly through this epidemic, which could become a pandemic. We don't have the testing. We don't know how many people are infected. The Atlantic's reporting that CDC is not going to report how many people are negative, so we're not going to have a grasp on the percentage of the people who are actually infected by this virus. As you say, healthcare workers are not, there's no plan to protect healthcare workers. There's no plans to protect those people, the entrepreneurs and people who are struggling every week on living wage, don't work with a lot of different people in the gig economy, people that are lower income. There are no plans right now to take care of them. So if some...
You know, I've done sit and thought about emergency situations, and somebody may laugh whenever I say this, but let's say that I was involved in the temporary emergency that just happened up in Middle Tennessee pertaining to a major tornado. And let's just say, hypothetically speaking, that I was one of the fortunate ones that my house didn't get riddled and torn to pieces, blown to smithereens. But yet now, it's going to take 3, 4, 10, in some emergency situations, up to a month before I'm ever going to have electricity put back in these rural areas, because they're going to concentrate more so on the developed areas where there's more people, where there's more houses, than they are the rural areas. I'm a diabetic. You're supposed to keep diabetes medicine chilled under a certain temperature. My automobile has been torn to shreds, but I'm still maintaining life. What do I do in a situation towards not having electricity, towards keeping my meds chilled or cold to a certain degree? And some may say, well, you run out here and you get you a bag of ice. Well, what do you do whenever that melts? Well, you go get you another bag of ice. Well, what do you do if you can't go get the bag of ice? What do you do if the ice is run out? So I've already done thought of a plan that if all else fails towards keeping my medication cool, towards digging a deep hole in the ground, give or take about 2 foot deep, and putting my medication down into the earth. And I believe even during the hot summer months, I may have to go, instead of going 2 foot, I might have to go 3 foot. But I believe that if I dig a hole deep enough, I could still maintain my diabetes medication to the point that it wouldn't spoil or go bad during the middle of a crisis. Now, how come our professionals doesn't talk about stuff like that, and also in revealing to the general population that if you can't find a mask and you believe that you're sick, rather than spread germs all over everything and everybody, make a mask, conform a mask, manufacture a mask. There's all kinds of ways. You can take a paper towel and basically create a mask that will keep your sentiments from dispersing out to somebody. And like they said a while ago, they have figured out that the main distance between somebody and another person is basically about 6 feet. You need to stay within about 6 feet of somebody, if you can, so that they will not disperse up onto you. We're reaching a critical era here, a period here, to the point that I'm kind of like some of these newscasters. It may be time for the president to put out a federal national emergency. A federal national emergency very well should have already been instilled into our emergency workers towards preparing for something like this. Because it is intensifying. It is growing. We got 22 deaths today. 554 that has been contaminated as of this morning. And I'm sure as this, it'll go through a sequence of 2 plus 2 is 4. 4 plus 4 is 8. 8 plus 8 is 16. 16 plus 16 is 32. 32 plus 32 is 64. 64 plus 64 is 128. I'm sure it will start out on a low level, but it will immediately climb as these numbers that we're going to be looking at. And I don't even know what the world numbers are this morning. I think it's somewhere, give or take, around 3,000 deaths and over 100,000 people that has been that we know of that has been exposed to this virus. It talks about these things that are going to occur in the Bible. And the bottom line is this to my viewers, and I do mean this sincerely. I don't care how many methods of pretension that we can take towards trying to prevent something from occurring in our lives. I don't care how many bullets that a human being buys here in the United States. I don't care how many guns that you have. I don't care how many times you wash your hands. Yes, all these things is good, fine, and dandy. But the bottom line is this. There's no one going to protect us except God and the Holy Spirit. And if this is meant to be fallen upon to the people towards perfecting society because of all the sin that has occurred, because God is basically lifting his umbrella of protection, and now we're seeing the great demon that is wreaking havoc upon to the world. The main thing is to be prayed up, packed up, and ready to go up, because none of us is guaranteed a tomorrow, and none of us is assured a guarantee, regardless of how cautious that we may be, either with germs or with buying guns or etc. There's no one going to truly save us except God Almighty and the Holy Spirit.
Somebody is sick, and if they don't go to work, then they know they're not going to be able to pay rent. They're going to be more likely to go to work and infect 200, 500 people who will then spread the disease when they go home at night, when they go into their communities.
Families.
But again, all of this requires leadership. All of this requires planning. All of this requires a president that can actually sort through all of these things. Or, we know Donald Trump is incapable of doing this. So it requires Donald Trump to understand, to know what he doesn't know, which is actually an important quality of great leadership, to know what he doesn't know and put people in charge who actually can sort through all of this. Because if he doesn't, then this crisis is going to get much worse very quickly.
Chaos.
So tomorrow is another big day at the ballot box. 6 states are holding primaries, and Michigan has the most delegates up for grabs at 125. Joining us now from Michigan is NBC News correspondent Heidi Priscilla. She spoke.
This could actually get so bad to the point that it would delay elections. I said from the get-go, whenever it was all happening over in China, that if it would have broken out over here in America, which we still don't know yet, it's still debatable, it would be total chaos, and the only way to maintain law and order over here would be through martial law, through military. There is a benefit to a communist-controlled country whenever you can basically tell everybody to hunker down, and everybody hunkers down the way that they did over in China, because those people over there don't have to rely upon paychecks like we do, because what they work for on a day-to-day basis, the government provides for them. And it doesn't matter if they work 1 day, 10 days, or 100 days, they get the same reward, which is a place to live. And a country that's under communist-controlled regime like that can put out the order towards lockdown, and it doesn't affect their citizens like it does in a country over here, to where if the president ordered for a lockdown, what are you going to do about your light bill? What are you going to do about your groceries? What are you going to do about your gas bill? What are you going to do about your automobile payment? What are you going to do about your house payment? What are you going to do about your insurance payment? I mean, these things are going to be devastating to people's lives. If they make it through the sickness, then they're going to have to readjust their whole financial status, because a lot of people are only working or living from one paycheck to another. So this could actually be what upsets the apple cart, not just over in China, not just in other parts of the country or other parts of the planet, but this could be what upsets the apple cart all over the world. That could be devastating for countries more so like us than it is China, because China can pick back up where China was, because once more, those people don't have house payments. They don't have electric payments. They don't have other payments. The government provided these things for those people. Whenever China said hunker down, they hunkered down. To where if we was to have something on that magnitude here in America, the only way to get people to hunker down would be to force people to hunker down. You would have to have martial law. You would have to instill some sort of military strong arm to be able to force people into their segregated areas to where the disease wouldn't spread near as badly. So for me, being a spectator, looking at the arena from the outside, I can actually see the benefit of both. And of course, democracy in my eyes have always outweighed communism. Always. We're just going to have to work our way through this, regardless of how hard or how uncomfortable or how inconvenient that it may be. We're just going to have to work our ways through this. And I do believe that the president needs to put out a mandated national federal emergency because of this. In other words, we need to try to nip this in the bud if we can. We need to address the issues that we know that are going to be coming up, especially if it grows and intensifies, in which on a day-to-day basis, that's what we're seeing, not only here in America, but throughout other parts of the world. The only reason why that it hasn't already been a level, let's say a level 7 or 8 or a level 9, 10 being the highest, the reason why that we're still right now at a level 1 is because there was preventions taken towards stopping the airfares, towards allowing for the disease just to walk on over here and take us over. But during the times that those airplanes was being altered was during the times we should have been making plans. What if? What if? And now that's put us where we are now today. Good luck to all of us from the Windmill Ministries here at 291 Thompson Road. And shalom.